Yeah, we are here and we're live. Yeah, we're doing new things today. I am Yolanda Harper. I am co founder of Harper Therapy. I'm here today with Dr. Elizabeth Pare, yes, of Every Rose LLC, and better known as Beth, right?
Yeah, this is my first ever Facebook Live.
Yeah, thank you so much for being willing to go live with us.
Absolutely. Thanks for
Yeah.
the invite.
Well, I want to make sure that people know about you and what you do. Because, as mental health providers, and especially in the trauma work that we do, we are always looking for good prescribing providers to refer to for when people want and need some medication to help with mental wellness, mental health wellness, right? And so tell me about Every Rose LLC.
So, I became a psychiatric nurse practitioner a few years ago when I worked in some inpatient settings, and then I started in outpatient. Um, and I realized that I wasn't going to be able to give the level of care that I wanted to give in most of the settings that I was practicing in. I really like to have enough time to get to know my patients, let them ask questions, me ask them questions, have a good idea of the whole picture of what's going on. And a lot of the settings I was practicing in, it was like write a prescription, oh, you only got a few minutes, move on to the next one, and repeat all day. So I decided to go on my own, and it's been much more fulfilling, I think, for me and for my patients to be able to take the time and make sure we're both involved in their care and making decisions about their care together.
I love that. What feels like it fits so well for you as the provider to be able to do things, offer care like this the way that you do? What makes it fulfilling?
Well, I love the feeling of I'm not just writing a prescription and sending them on their way and hoping, maybe it'll help. I feel, when I really know what's going on with them and they've really had time to give me their input, feel more confident that that what I'm prescribing is going to help them and that they fully understand why they're taking it, what to expect, and what makes, the most fulfilling part is when people come back and they say, I feel like myself again, and they're so happy and they're so relieved because nobody wants to feel depressed or anxious or any of that, and that's what all of us want to feel is like our true selves. So that part, I love feeling like I'm able to have a part of that.
Yeah, that's amazing, isn't it?
Yeah, absolutely.
And what are you hearing from your patients, the people who are coming in to see you? What are you hearing from them about is different with you that their experiences?
Yeah, they've been really appreciative, and a lot of times they say, I've never had, we talk a lot, and they say, well, I've never had an experience like that where I was able to get it all out and not feel rushed, and they really appreciate it, and that makes it even, that's another thing that makes it even more fulfilling. I can tell that it really means something to them, that they're feeling heard.
Right. Totally. And that's the feedback that we have heard about people in their experience with you, and how amazing it is to have that time to have these conversations, and then to have really a better understanding of like, oh, this is what's going on with me and this is the medication, instead of having to go home and like Google it. And, like, what's going to, so tell me about that.
Yeah. Taking medication, especially for people who've never taken a medication before, it can be scary, it can be intimidating. So I like them to, again, have all of their questions answered so that they're not looking on the internet and scaring themselves.
Yeah, Dr. Google,
right,
that can be scary.
Having all, not leaving like feeling more anxious maybe than they came in about taking this new medication. So I just think about if I was struggling with something, the person that I was going to see, how would I want them to provide care to me? Or a family member, if it was my mom or my sister, what kind of care would I want them to receive?
So who are the people who you help? Who are the people that find you that, are like the best fit for your practice?
So I actually see a lot of kids and a lot of teenagers.
Which is good. If you guys don't know this, if you all don't know this, then it is really hard to find a provider for anyone who is a kid or teen. So that is your go-to if you are looking for someone to help your child or a loved one. Yeah.
Yeah, that's been most of my experiences with kids and teens, and I kind of am a big kid, so
Yeah.
I really enjoy that population. But I see adults too.
Hmm.
Yeah, I don't see geriatric. I think I have some providers that I refer to that I think
Right.
would be a better fit. But
Right.
other than that, I treat depression, I treat anxiety, I treat bipolar disorder.
Hmm.
Um, a lot of times with the kids, there's some behavioral things where some like trouble in school, ADHD, that type of thing. So
Hmm.
any of those would be.
Yeah.
And I always encourage people, you know, if you're telling somebody about me, it doesn't have to, they don't have to schedule an appointment with me. They can still
Right.
call me. They can ask me questions. I can help find them resources. I'm
Right.
working on building a network so that I can try to help everybody and
Yeah.
clear things up. Just because mental health in general, it can be tough to navigate.
Yeah.
So.
What do you wish people knew about navigating through mental health and mental well-being just in general?
Well, of course, it's no secret that there's a huge stigma still with
Yeah.
mental health.
Still. Hmm.
So I think we're making progress
Yeah.
in that arena, like, as a society. But I just wish that people knew how much more common it is than they might realize. Like, people, they feel ashamed or embarrassed or weak. But I think if they knew how many people they come into contact with on a daily basis that are, probably struggling with similar things, it wouldn't be so, they wouldn't be so ashamed. It wouldn't be so tough to talk about. So I wish that people understood that it's just part of being human.
Yeah.
And it's okay.
Yeah. Yeah. We're more alike than we are different.
Right. And there's strength in seeking help. It's not weakness, it's strength.
Yeah. I happen to agree with that. Yeah. Yeah. So again, what I want to make sure everyone understands is that Beth is an amazing provider, a prescribing provider. I know a lot of times some of the challenges that we hear from our clients who are looking for, people to help with medications is I feel like they don't listen. I feel like it is kind of like a rush in and out kind of thing. I don't necessarily understand, what this medication is for, or can't I just stop taking it? Those kinds of things.
Yeah.
And your experience with Beth is that she's going to talk through concerns that you have and get you in pretty quickly.
So I never want anyone to feel like I'm pushing medication on them or like pressuring them to start medication. I like to, whenever I see somebody, I try to give them options. And any of the options that I give them are going to be, evidence-based. I think any of the options would help. I'll let them know, I think this is the one that I would most recommend, but is there something you're more comfortable with? Or, sometimes people just, they want the information. They may decide not that, that it's not the time for them to start taking medication, but I'm never I never want to be a pill pusher or, have them feel uncomfortable in any way. It's more of just, I try to work a lot of education into my appointments so that people feel empowered and instead
to make a decision that works best for them.
Right.
Yeah.
Absolutely.
I love that. So you're offering, here are some different options of medication. This is the benefit of this. This is some of the maybe side effects that you'll want to keep an eye out for.
Right. And sometimes, sometimes somebody has had a family member or a friend that had a bad experience with the medication, and so they're less comfortable with that.
Yeah.
And it doesn't mean necessarily that if a friend or family member, it didn't work for them, it doesn't mean that it won't work for you. But at the same time, if you're not comfortable with this, you have this, this preconceived notion about this medication, there's other options. It's, a big part of it is what you're comfortable with.
Yeah.
So.
What would you say is showing up the most for you in your practice as far as mental health these days?
Well, I think COVID, of course, is probably, COVID has caused a lot of changes in general, and I think in a lot of ways things are going back to normal, but some of the changes are here to stay, and so I think isolation has been really tough for a lot of people.
Yeah.
And that's brought out some underlying things for some people, or some people are experiencing the loneliness and the depression and just the anxiety about what's going to happen.
What's going to happen?
Things that they've not experienced before.
Mm-hmm.
And again, that's normal. It's
right.
you know, so that's been a big thing lately for sure. And with the kids and teens being out of school, that's a big deal for kids, the social interaction when they're developing and everything. So, and you know, just the adjustment in itself from being in person at school every day and, you know, face to face with teachers and the other students to online school.
Having to figure out online school.
Right.
And,
transitions are tough for anybody, and this is, you know, some of these transitions we've kind of been forced into. So, so that's it.
What is the youngest that you see? The youngest child?
The youngest that I see is 4 years old.
Okay.
I usually don't medicate kids that young, so that would be a very rare, a rare case. But I do see kids as young as 4, and most of my kids are in the, you know, 8 to 16-ish range, I would say.
Right. So elementary through high school.
But 4 would be the youngest, all the way up through 65.
Okay, that was going to be my question on the other end. So I know that you don't do geriatrics because that can begin to be complicated with other medications and stuff. But 65.
Yep.
Perfect.
Yeah.
All right, everyone. Beth, thank you so much for doing this live.
Absolutely. Thanks for having me.
Yeah. All right, guys, give Beth a call. Her contact information is right here. We'll talk to you soon.